This is what a physical therapy dry needling session looks like for a C-section scar. It's private, so there's time to change. And when our physical therapist walks in, she gives you time to have a conversation and further discuss what it is that you're looking to accomplish. In this particular case, the patient's scar is over a decade old. So it goes to show that you can do work on a C-section scar long after delivery. The doctor uses one of her ultra-fine needles to actually move through the scar tissue. What's neat about scar tissue is that once you break it up, it stays broken up. It's not like a muscle that can get tight again. So in working on a scar, even a scar that is over 10 years old, you can really break up those adhesions and that tension, especially the tension that creates that shelf, because what happens is that scar is so tightly wound into the pelvic floor, into that abdominal wall, that it then forces the tissue on top to kind of bulge out, creating that shelf look that a lot of women try to work on in regard to the malleability and movement of that scar tissue to essentially help get rid of that shelf look. This procedure is not necessarily painful, but it can evoke emotion and it can be intense. So in this case, the patient needs time to take some really nice deep breaths and move along with the physical therapist. The nice thing about our setup here at the clinic is that our physical therapist has the time to really give the patient what they need in regard to breath work or even pelvic floor work. When the doctor is applying the needle, the doctor can also then move the needle so she can either twist the needle or move it up and down to again help break up those adhesions. She can also just leave the needle in the tissue for a certain amount of time, whatever is deemed necessary, and then she can remove the needle. It does not hurt to remove the needle. It typically does not create any excessive blood or exchange either. Once the needle is out, the doctor can work on the tissue itself with her hands to really create a lot of length and pliability of the scar tissue itself. Here you can see that she's actually applying pressure on the scar tissue itself and, of course, the surrounding tissue. She can hold there or she can move back and forth. Again, whatever is deemed necessary for the type of scar. It depends on how long somebody has had it, how fresh it is, how much they've worked on it themselves prior. But applying pressure like this and creating length like this, again, only aids in making the scar tissue more pliable, which again adds to the functionality of your pelvic floor, of your diaphragm, of all the surrounding musculature. Here you'll see the doctor applying pressure and then having the patient create active movement. So activating the surrounding muscle tissue while she's also pinning the soft tissue surrounded by the scar. So when you do this, again, you create length, not just for the scar tissue itself, but for all of the surrounding musculature, which only aids, again, in the functionality of all of that surrounding tissue. When that occurs, pain symptoms can go down. Again, breathing can get better. Your pelvic floor functioning can get better. Anything that you've been dealing with surrounding that area can improve and heal. And just remember, it's never too late to do the work. You can be years out from delivery, from this type of surgery, and you can still put in the work and the time. We always recommend seeing a professional to talk about the functionality of your pelvic floor, of the area surrounding your scar, and all of the musculature surrounding your abdominal wall, because there is just so much you can do way late in the game. So don't get discouraged, don't be frustrated, seek out a professional, ask for help, ask for advice, And know that there are lots and lots of things you can do to help with that scar tissue.